So first, you brought up something so important, which is just being able to find someone who is a trained therapist, counselor, psychiatrist, if that's needed. And one of my colleagues sort of bravely tweeted out last week, she's an African-American young woman here in this city, about how hard it is to find care.
Yes.
And then if you can find a therapist that you feel like relates to you, and I'll point out here that the American Psychological Association reports that only 5% of the country's psychologists identify as Black.
That's right.
If you can find a therapist that relates to you, your insurance may not cover it.
That's right.
If you have insurance. So how do you deal with this need for care so people can have that long-term, ongoing, developed relationship with someone who's trained and knows how to help them through what they're dealing with?
Well, in New York City, we have this helpline, 1-888-NYC-WELL, and anyone who calls that number is provided with some kind of appropriate care that is convenient for them. We don't turn anyone away. It doesn't matter whether they have insurance or not. We know how important this is. It has to be a priority. And you asked about the federal, the state, the cities. We all have to make this a priority. We have to find ways that people can connect to care. If we don't, it can have lifelong consequences. It can result in someone's death. Or the devastation of a family. We have to find ways to connect people to care. And when it comes to populations like the African American population, the LGBTQ population, Latinos, so many, we do not have the culturally competent care that we need. We just don't. That statistic, 5% of the mental health professionals in our country are African American. Just imagine what it is for other ethnic groups. So we need to create a pipeline of care. We need to get more African Americans and other ethnicities involved in the mental health workforce. But we also have to employ task shifting. We have to train people who are already doing this work, like our clergy, like community organization leaders. We have to train them to do some of this work as well.
So whose responsibility is it to tie it all together, right? To bring all those communities together? And why do you hope that it works at the citywide level?
Well, the problem is we've never had a coordinated behavioral health system in our country, ever. I mean, I just find that astounding. This is 2018, and we have so many issues that relate directly back to the fact that we don't have this system, and no one has really taken responsibility. There are many good services, and many of our elected officials are doing amazing things, but there is no national will to get this done. I think that everyone has to do their part. And as individuals, people can volunteer, they can pressure their candidates, people who are running for office, to make this a priority. We all have to do that, otherwise it will not happen. And we have this coalition called Cities Thrive, where we're talking every month to mayors all around the country and sharing best practices, like sharing what we're doing in New York with Thrive NYC, and best practices in other places, like whether it's New Hampshire or Kentucky or Seattle, sharing really innovative solutions to what is really a mental health crisis.